Hi everyone, my name is Dexter Hemphill. I'm a DNP anesthesia student, and today I'm bringing you a community health assessment focused on my hometown, Greenville, Mississippi. This presentation aims to dive into the health, infrastructure, social environment, and overall well-being of the residents of this community. I chose this community not because it's home, but because I've seen the need firsthand. So this is personal for me. There's a story here worth telling, and even more so, worth fixing. Greenville, Mississippi sits in the heart of the Mississippi Delta, located in Washington County with a population of 28,775 people. It is a place marked by deep health and economic disparities, but also rich in culture, community pride, and resilience. Riding through Greenville, expect to see a mix: aging infrastructure, potholes big enough to swallow your car and your neighbors as well, but also schools, churches, and evidence of strong community ties. Public transportation is limited, which affects access to health care and employment, but socially, however, the city is deeply rooted in faith and fellowship, providing opportunities for outreach and health education. Delta Health Systems is the primary hospital in the area, and it provides a range of medical services. There is also MSDH Clinic, or the Mississippi State Department of Health, that operates as a local health department in Washington County. Many residents rely on emergency rooms for basic care. Clinics are few, and Greenville is considered a health professional shortage area, which means there is a lack of primary care providers and specialists. This shortage directly impacts outcomes for chronic illnesses and preventative care. Now let's look at the social determinants of health. Population is just under 29,000. Median household income is around 25,000, well below the national average. Unemployment sits at around 10.5%. Only about 72% have a high school diploma. Healthcare access is limited. Chronic diseases like diabetes and hypertension are common. The social determinants are stacking the deck against wellness. But don't count Greenville out. There are strengths in the people of this great city: strong faith-based organizations, a sense of togetherness, and a culture that values helping your neighbor. Local churches often host health screenings and food drives. There's an obvious deep sense of pride in Greenville's history and culture. Nonprofits and small businesses are active and engaged and could serve as a key partner in public health efforts. Still, the challenge is real. Economic decline, food deserts, meaning many residents don't have access to nutritious foods, underfunded education systems, and healthcare gaps paint a tough picture for Greenville. Preventable illnesses are taking citizens out much too early. It is imperative that we shift from a reactive care to a proactive intervention. To get the full picture, I used a mixed method approach: quantitative data from the U.S. Census and county health rankings, qualitative input through windshield surveys and informal community conversations with residents to better understand their lived experience. This hybrid approach lets the numbers speak, but also gives a voice to the people. The economic and population data came from the U.S. Census Bureau and the Mississippi Economic Council. For educational statistics, I use information from the Mississippi Department of Education. Health data was sourced from the County Health Rankings and the Mississippi State Department of Health. So what's the game plan? The purpose of this community health assessment is to identify key issues so that we can plan effective interventions. This assessment will act like a flashlight in a dark room, highlighting the gaps, but also showing where change is possible. The goal: empower residents and stakeholders to make informed, strategic health decisions that change lives, not just treat symptoms. A community health assessment isn't just a snapshot, it's a blueprint for action. So none of this matters if the people don't see it. To ensure the findings reach the community, I plan to present them at local town halls and partner with churches, schools, and clinics. We also use printed infographics and social media campaigns to reach a broader audience. Printed materials in clinics and barbershops where the real talk happens. We need to meet people where they are. The more accessible this data is, the more empowered the community becomes. So here's the move. The number one goal is to increase access to primary care and health literacy by 25% over the next year. This includes launching mobile health clinics to improve access, hosting health fairs, and offering nutrition workshops in partnership with local nonprofits. To evaluate my effectiveness, I want to do pre- and post-intervention surveys, attendance tracking, and stakeholder feedback. This initiative is grounded in person-centered care and promotes interprofessional collaboration. Big thanks to everyone who was willing to take the time to learn about Greenville's journey to better health. I believe in this community, and I believe in action backed by data, heart, and collaboration. Let me know of any questions anyone has.